Hello, greetings from the Department of Pediatrics, Jehangir Hospital. I am Dr. Sanjay Bafna, consultant pediatrician specialist in pediatric intensive care and pulmonology. I am going to talk to you about severe COVID infections in children. My colleagues have already spoken a lot about the routine infections, and let's focus on this topic, and I would be taking you through with a lot of queries and concerns which you usually have regarding this topic. So what do you mean by severe COVID infections? Basically, as you know, COVID virus is a respiratory virus and it involves mainly your lungs, and therefore any child who has severe infection would obviously develop what we call as COVID pneumonia. There are other systems which are rarely involved, like you may have loose motions, vomiting. Some children may have brain swelling, what we call as encephalitis or a brain fever. So by and large, it is respiratory infection which becomes severe in COVID. So the next question comes is how common is it? So now as we know, fortunately, most of the children do not develop any symptoms. A very few would develop minor symptoms, and on these children who are symptomatic, out of that very minuscule, so 5 to 10 out of 1,000 would develop severe infection. So that's very fortunate as far as children are concerned. So the next question is, which are the children who are at risk of developing severe COVID infections? So if your child has diabetes, chronic disease of the liver, lung, heart, or if he is on some medications like steroids or chemotherapy which would depress your immunity, these are the children who may develop severe COVID infections, and the parents of such children should be more cautious in seeking medical help. Now, as a parent, how do you recognize or pick up whether the child is developing something which is more serious or severe? So simple things I would let you know that you need to look at his breathing. If the child is breathing fast, or he has breathing difficulty, or if he exercises and gets easy fatigue, or if he is excessively restless or has abnormal behavior or drowsiness, you should be worried. Fortunately, again, as I've been emphasizing, these are rare symptoms of severe COVID infections. The next important question which parents have is, can I monitor my child at home objectively? Yes, there are certain tools which you can look for. Older children, definitely you can monitor their breathing rate, which should be roughly between 20 to 30. Of course, with age it decreases. Then you have pulse oximeter. Fortunately, at home most of the parents have. So after activity or exercise, the pulse oximetry should be above 95 in these children. You can do a simple count, like a single breath count. Tell your child to count from 1 to 20 or 15 in a single breath, and most of the children should be able to do it above age of 3 years. And then of course you need to monitor the urine output. So see to it that the child is passing frequent urine. So in case you come across these signs, where do you seek help? So I would like to tell you that Jehangir Hospital has a wonderful casualty department where the help is available 24/7, and it is backed up by resident doctors, and immediately the consultants are also available to give advice, and whatever is required can be done. So it should be your one-stop help seeking institution, but of course if you have far away any nearby medical center, you should seek help. So if you bring the child to hospital, what are we going to do in case? So most of the children would need home medications or home quarantine, but if you bring the child because of moderate symptoms, this child will go to the ward, probably would need some IV fluid administration and some basic test, and monitoring is what we are going to do. But if the child's oxygen saturation is dropping or his oxygen level is low, then he would be put on oxygen, and rarely we may have to give them steroids or remdesivir. I am sure most of you are aware of these medications, which are rarely used in last 1 year. Hardly ever we came across a child who needed these medications. So next question is, what is the outcome? So fortunately, again, I would like to tell you that it's a good news for pediatricians and the parents that most of these children, even after moderate or severe infections, would go home happily, and there are hardly any deaths by COVID in children only because of COVID. Usually the deaths is because of the other comorbid conditions which they have. Now, is the story over if the child has recovered completely? Yes, in most of the children, but some children you need to look for some signs, like there is some syndrome which is peculiarly described in children, which is MISC. Dr. Lard has spoken to you about this. So you need to look for persistent fever or any lethargy or any severe abdominal pain or rashes which comes after 2 to 3 weeks of recovery. So please look out for this, and in case there is anything, please get in touch with your doctors. And the last question, I think, which most of you have is, doctor, what precautions shall I take to avoid COVID? I think COVID is like any other viral infection. So what is more important is, good nutrition, proper positive parenting, timely immunization, and of course SMS. Never forget social distancing, masking, and sanitization. That is a golden rule. And there are a lot of questions about mask. You can use any mask, not necessarily N95 mask. Above 5 years, definitely. Above 2 years, it is optional. And children should play. Children should be allowed to play definitely in the society. That's an exercise for them. So lifestyle changes, less of the screen time, and good diet. I think is the immunity booster for them, and that's what is required to avoid any infection, and COVID is no exception for that. Thank you for your patient listening, and if there are any questions, we are available at Jehangir Hospital. I'm Dr. Sanjay Bafna. You can contact me through Jehangir Hospital. Thank you so much.